Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you all know, this is a webinar where we're going to discuss some Lyme disease, tick-borne illnesses, and a little bit of mold toxicity, I'm sure. All right. So it's good to be back here with you tonight. I know it's been a number of weeks since we've been together. Many of you may know I've been relocating from Austin, Texas, back to Seattle, Washington, and so that's a whole bit of a process. I thought of taking a 1-week trip, but riding my motorcycle back, and then I had to go back and pick up my camper van. So anyhow, we should be back doing these webinars on a more regular basis now. And for those of you that are interested, I'm actually in the process of reopening my medical practice back here in Seattle as well too. Beginning on October 15th, we'll start taking consult visits, and these are educational medical consults where I can give you advice on what to do, but I can't do the prescribing and I can't do the ordering of tests or make formal diagnoses. This is more informational for you to consider for things to do with your care, but also to show with your healthcare provider. And then beginning around November 15th, we should start doing full medical service visits. And initially, we'll try and make people come in for their initial visit here in my Seattle office. Later, I'll show you where you can find out more information about how you can sign up for those. But we already have people signing up for the October educational consult visits. And tonight, I might even suggest that some of you consider taking me up on that as well, too. All right. So the other thing, tonight I am recording of tonight's event. And sometime tomorrow morning by around 9:30 to 10 a.m. Pacific Standard Time, Seattle time, I will have that a summary of the recording written for you and send it out to you through email. That will also have a link to the YouTube video, and if you watch it on YouTube, you actually be able to use timestamps to hop around to the relevant areas that you want to do that. Okay. I don't think there's anything else here. So tonight, as we're doing a webinar, I will be posting questions on the screen so you can see them. And if you are participating in the live version, you won't be able to see those. Those questions do not show up in the recorded version, though. And so for that reason, I will be reading those questions out loud so that people that are participating in the recorded version get to hear what the questions were about as well, too. Okay? All right. And then, let's see, let's go and get started here. All right, so this is first question is from Colin. Hi, Colin. Let's see, how much magnesium is commonly suggested to take, and when should it be taken? Which infection potentially lives in the skin? When I wash with antifungal shampoos or Castile soap, pine tar, etc., I get very tired and emotionally numb, apathetic. Which infection causes neck instability and cracking? Thank you. All right. So regarding the neck cracking, it tends to be a symptom that we see more with Borrellia, so the Lyme infection. And why that happens, I haven't seen a good explanation for that. I haven't seen a good scientific explanation for that. We tend to think that cracking is being something that is more associated with Borrellia. In terms of which infections live in the skin and therefore would cause some worsening of symptoms when you use antifungal shampoos, basically, Borrelia lives everywhere. It can get into the dermal layers. It can get into your muscles. It can be everywhere. Babesia tends to be more of a blood-borne infection, but again, the blood flows everywhere too, all right? And then in terms of Bartonella, it's an intracellular infection and also infects the lining of your blood vessels, so it's going to be everywhere as well too. So as to which one of those might be leading to some of your reactions, I don't know. But I just want to let you know all of them can be all over. It's just that Babesia is in the blood, but blood vessels go everywhere, okay? And Bartonella can be everywhere, as Borrelia can be everywhere as well, too, okay? And I haven't heard of somebody having that kind of reaction before, so I find that interesting. I'm not quite sure why that's happening, though. And then in terms of magnesium, depends on what purposes you're taking it for. So if somebody is having difficulty sleeping, I prefer to use magnesium glycinate. And the reason I like the magnesium glycinate is it tends to be well absorbed, tends to focus throughout the body, but within the central nervous system as well too. And compared to other magnesium salts, it does not seem to lead to the loose stools and the diarrhea that some of the other magnesiums can. In terms of a dose that I like, in terms of sleeping, anywhere from 200 to 600 milligrams can be useful. If you are wanting to use magnesium more for your muscle achiness, I tend to like using a combination product that has some magnesium malate and magnesium citrate in it. The malate seems to be a good form for more muscular tightness as well too. So be aware of magnesium malate and citrate, which Thorne makes a product called magnesium citronate. That's why you can find both of those together. That has a little bit more of a tendency to give loose stools. But if you're going to be using it for muscle achiness, anywhere from about 200 to 400 milligrams 3 times a day, you may have to temper how much you take based on whether you get loose stools or not. Okay? All right. Thanks for that question, Thomas. Good luck to you. Hello, Jessica. Let's see. My daughter and I both diagnosed Lyme, Borrellia, and Bartonella, and we both are experiencing chronic dizziness and balance issues. When we do any treatment, detox protocols or supplements, herbals like Japanese knotweed, cat's claw, oil of oregano, clove, curcumin, red root, cinnamon, glutathione, we get dizzier. It's quite unbearable and can cause extreme bouts of vertigo. Adrenaline does not help. Do you have any suggestions for this? How to lessen this with any treatment? Anywhere with treatment. All right. So, dizziness can be you mentioned the word vertigo. That's a feeling like you're on a merry-go-round, or you're spinning around, or you're out of balance. Okay, that would be what I call vertigo. Other form, and that's one form of dizziness. Another form of dizziness that people will often describe is that feeling of being cloudy or lightheaded. Okay. In terms of the cloudiness and lightheadedness, that could be either Borrelia or Bartonella. And then when I think of somebody as having more vertigo type symptoms, I'm thinking a bit more Bartonella, but Borrelia can do it as well too. All right. It could be that it's getting worse as you're killing germs as part of a Herxheimer reaction. Many of you may be familiar with that term, but basically, when you have Lyme disease symptoms or Bartonella symptoms or Babesia symptoms, major cause of most of those symptoms, most of the symptoms, when your immune system is trying to get rid of those germs, some of the white blood cells that see the infection manufacture a group of chemicals which are called cytokines. Okay, and cytokines give you most of your symptoms. So cytokines give you fatigue, make you feel lightheaded. They can give you brain fog or confusion. They can give you body pain, tiredness. They create insomnia. They interfere with how your hormonal systems work, etc. So most of your underlying symptoms that a person has are going to be more cytokine related. Okay, now when you start killing germs, the immune system will see the dead bug parts as well as toxins that get released from the inside of those germs and produce more cytokines. All right. So often, your underlying symptoms when you start killing germs will get worse because those underlying symptoms, most of them, are related to excess cytokines. And when you start killing germs, you trigger even more excess cytokines, or we call that a Herx reaction. If I were working with you, I would, first of all, want to have a better clarity as to whether this is more of a cloudiness, fogginess, dizziness, or if it's all more vertigo. And I would ask you a lot of questions to help figure that out. Okay? All right. But because it seems to me that they're getting primarily worse as you treat or you manage it with some of those herbal antibiotics, what you might want to consider doing is cutting back on the number of herbal antibiotics or the amount of the herbal antibiotics that you're taking to kind of not be as aggressive with your Secondly, make sure that you're doing things to lower cytokines. And the big things that I like using, one of those is the glutathione you're using. I like using glutathione. So glutathione is a very strong antioxidant made in every cell in the body. It's an antioxidant that's used by the liver to do detox. But as an antioxidant, it also knocks down oxidizing agents that tell your white blood cells to make cytokines. Okay, so you can use glutathione to limit the that is telling your cells to make those cytokines. The form of glutathione that I like working with is liposomal glutathione. And the reason I like using a liposomal variety Liposomal means that it's glutathione microscopically wrapped in fat, and that microscopic amounts of fat increase the absorption of the glutathione. If you don't use a liposomal variety, the absorption of the glutathione can be kind of erratic and may not be that useful. Okay. The product that I like for my liposomal glutathione, this is because it's got extensive research showing it's well absorbed, is a product made by Research Nutritionals, which is called Trifortify, and I like having people take a teaspoonful one time a day. In situations where they're having more severe reactions, maybe some of the increased dizziness here, for instance, you might consider doing 1 teaspoon twice a day. All right. Second thing that is useful at controlling cytokines as part of first reactions, and also just to help manage your symptoms better too, is to work with curcumin. And with curcumin is a component of the Indian seasoning turmeric, and it's very useful at getting inside of white blood cells and limiting the production line, blocking the production steps that lead to cytokines, okay? The product I like for that is also a liposomal variety, and the reason I like using liposomal there is turmeric and curcumin from turmeric are horribly absorbed also. But if you use a liposomal variety, you can get increased absorption. The product that I like using for that, then, is a product by Thorne, which is called curcumin phytosome. The phytosome is, and I like to have people take 500 milligrams 3 times a day. So 2 things that you may want to consider, or 3 things, you may want to consider decreasing the amount of the various herbal antibiotics that you're doing. I actually do see you're using curcumin here, but I want to make sure you're taking enough. So I would do 500 milligrams 3 times a day and make sure it is a liposomal variety. If you're not doing liposomal, it's probably not being well absorbed, okay? And if you are using 500 milligrams 3 times a day and you're still having problems, you can even bump it up to 1,000 milligrams 3 times a day. And then the liposomal glutathione I like, again, it's a Trifortify product, and I would do, if you are on a teaspoon a day and you're still having these symptoms, I would consider going up to 1 teaspoon twice a day. Okay, so those are some things for you to consider, all right? I'm going to do a quick screen share here and show you guys something. Let's see here. Okay, so this is I'm not sure if you guys are seeing it. Okay. They've shared, I usually can see a button here that says I'm sharing my screen, and they moved where it's located here. Anyhow, this is my online information site and supplement store, all right? So in terms of information about cytokines and Herxheimer reactions, take a look in this section here called Herxheimers and Cytokines. And then if you want to read more about cytokines and the steps that I talk about to manage them, take a look at this article. If you're really wanting just more information about Herxheimer reactions, take a look at this article, okay? And then in terms of the products that I'm recommending you consider, take a look at the, in my supplement store here, take a look at this section called Cytokines and Herxheimer reaction, and I would take a look at this curcumin phytosome right here, and then the various Trifortify products. These are all of them right here. These are good products for that as well too. Okay. All right. Let me go back here. Okay. So thanks very good luck with your turn. Hello, Eric. Let's see. Hi, Dr. Ross. Hope you are well. I am. Thank you. Well, I'm exhausted from all my questions, but here we are. Let's see. I have a hydroxychloroquine question. My LLMD has me on clarithromycin 500 twice a day, ceftonir 300 milligrams twice a day after 6 months of nalurone, azithromycin, and rifampicin. I have Babesia oticoli, Bartonella henselae, and Borrellia afzelii. Stating tafenoquine for back pocket due to risk. He also prescribed hydroxychloroquine 200 milligrams twice a day with the clarithrone ceftonir. It seems sometimes upset my stomach and lead to very loose bowel movements and running to the bathroom for a couple hours. Do you have any thoughts or ideas on how to combat that? Also, can you speak on the retinal toxicity risk related to vision that hydroxychloroquine can cause? Concern about risk to vision. Also, Can you speak at all about depersonalization, derealization symptoms, and feeling disconnected from the world of Lyme patients, and how and why those manifest? Thanks so much, and hope reopening your practice. Thank you. So let's just talk about hydroxychloroquine. So hydroxychloroquine, everyone, is a quinine medicine that was originally developed to manage malaria. And because of that, there are some protocols where it might be useful against babesia, but not as a single agent. And I'll say more about that here in a minute. The other thing that we can use hydroxychloroquine for is it's a pretty good anti-inflammatory. And in fact, the number one prescribers probably of hydroxychloroquine are rheumatologists. They are using it for a lot of their, as part of treating a lot of their rheumatologic conditions. Okay. The final thing that we can use hydroxychloroquine for is it is useful at changing the acid levels inside of your cells to make them less acidic, so that clarithromycin, azithromycin, intracellular antibodies, even rifampin, might work better. Okay, all right. So there's three reasons we might use hydroxychloroquine. One is it anti-inflammatory. Number two, it can help your intracellular antibiotics work better. And number three, it may have some weak antibabesial properties, but not as a sole agent. All right. So where I like using hydroxychloroquine in a babesia treatment is I like adding it to something called primaquine. So primaquine is in the same family as your difenaquine. Difenaquine is the newer drug. These are very useful drugs at treating babesia. Before difenaquine, I was relying on primaquine as an alternative to the standard other medicines we use. And there is a protocol you can do that is a primaquine hydroxychloroquine protocol. Okay, all right. Oh, I should say there's a fourth reason that some providers use plaquenil, and that is there is some people believe that it might treat the cyst form of Lyme. Many of you know Lyme has a spirochete, that's a corkscrew-looking thing. Lyme can morph into another form where it loses its covering and moves inside of your cells. We call that the L form, or intracellular Lyme. And then Lyme has a microscopic cyst form, okay? And the hydroxychloroquine may treat that. I will tell you, though, there's competing laboratory evidence. There's some evidence that suggests it might increase the cyst form. So I don't use it as an anti-cyst agent, okay? All right. Now, about the point about retinal issues. So using hydroxychloroquine can be associated with retinitis, or inflammation of the lining of the back of the eyeball. That does not happen at lower doses, though. Okay, so if you're using a dose of hydroxychloroquine that's 200 milligrams twice a day or less, the risk of that happening is next to zero. And in fact, I used to take all my patients that were on 200 milligrams twice a day and send them off to the eye doctors to get regular eye screening. And eventually, the eye doctor started sending them back to me saying, stop. You don't need to when you're on 200 milligrams twice a day. Now, if you get up more like the 400 milligram twice a day dosing or higher that rheumatologists will use, yes, then it is an issue. And then you should wind up getting regular eye screening. But if you're a dosing of about 200 twice a day, you're safe. You don't need to have regular eye screening, and there is not an apparent risk of retinopathy that would happen from that. Okay? All right. Now, let me see about your other question. In terms of the depersonalization, derealization symptoms, that is a neuropsych type symptom that could be associated with Borrellia, but in my practice and from what I've seen, I think it's more related to Bartonella. So Bartonella can lead to neuropsych issues. Borrelia can too, but Bartonella even more so. And so there's a whole range of neuropsych issues you might see with Bartonella, including various neuropathies. You might see psychoses, for instance. You might see depersonalization. You might see depression. You might see ongoing persistent anxiety. Those usually fall within the realm of Bartonella. And as you get Bartonella under control, often that will get better. Why it occurs, it probably is an effect of cytokines. Why some people are affected when they have cytokines leading to depersonalization and other people do not, I have never seen a good explanation for that, okay? And then, let's see, in terms of making it so your stomach can handle this better, the only thing I've tried before when I have people that have upset stomach on the hydroxychloroquine is to take it with food. Beyond that, I don't have a good idea for you. And in fact, I've had to stop it before because people could not stomach it. Okay, but that would be my thoughts for you on that too. All right. So I hope that gives you some insights there. Good luck to you, Eric. Hello, Liza. Efficacy of cefuroxime pills versus ibuprofen for Lyme. If I start with cefuroxime, will ibuprofen not work as well on the bacteria later on? That's a good question. In fact, currently there's a necropath here in town that is interested in joining my practice. So we actually had a dinner, or we got together for coffee yesterday afternoon. We were talking about this very point about IV versus. And, when I first started managing tick-borne illnesses back in the early 2000s, at that time the East Coast doctors tended to use a lot of IV antibiotics, and the West Coast doctors tended to use a lot of oral antibiotics. Right? These days, I think most doctors are pretty much just focused on doing oral antibiotics. And the reason is we really don't see much added benefit for doing IV antibiotics. In my experience, what I have seen is oral antibiotics will work to get a person well about 90% of the time, versus IV antibiotics may work to get a person well about 95% of the time. So you might have about a 5% difference in benefit, okay? But the issue with the IV antibiotics, there's a lot of risk taking IV antibiotics. Number one, there's the cost issue, all right? Often insurance companies are not covering them. The summary pricing has come down in the last year, but it still is not an inexpensive drug, especially since insurance companies still seem to be mainly covering for 1 month, and that's about it, okay? Number two, if you do IV antibiotics, you're probably going to get what's called a central line put in, an IV that's left in place. And that can either be something called a tick line, which goes into your vein out here in your arm, and it's fed up, and the tube lands just above you, in the big blood vessel above your heart. Or you might get something called a true central line that goes in underneath the clavicle, okay? All right. Now, the problem with those lines is they are susceptible to getting infected. Even if you use grid sterile technique, there's the risk. And second risk is that they can develop a blood clot, all right? And so if you are using a central line like this, there's a risk over about a 6-month period of time, about a 20 to 30% risk that you're going to need to have that line pulled out, either because you get a bloodborne infection from it or you get a blood clot. And keep in mind, with those blood clots, they can break away and they can kill part of your lungs, all right? So for that reason, I tend to not to use, I don't use much in the way of IV antibiotics. In terms of your question, in other words, I think orals work relatively as well. They're not IV is not going to get you better any quicker. IV may have a 5% better chance of working than oral, but oral still has a good chance of working. And then you have all of these risks, okay? All right. Now, in terms of if you start with oral, and then does that make it that you'll have less of a chance the IV will work later? No. In fact, I've done that with a lot of patients, and not a lot, but I would start with oral, and we would just get to a point, maybe about 6-9 months, they were just not making any headway, especially people with severe neurologic Lyme. Then I might switch over to IV antibiotics, okay? And have done that a number of times with good success. So I don't think that it limits your ability to get better if you start with oral and then have to switch over to the IV later, okay? All right. Good luck to you, Liza. Hello, Joyce. Hi, Dr. Ross. Thank you for continuing to share your time through these webinars. A little over 1 year ago, I moved from Arizona to North Carolina. It has been a stressful year and experienced a resurgence of Lyme 3Bs, officially diagnosed in 2016. Symptoms, feeling cold, chills, feverish, exhausted, random aches and pains, all beginning shortly after moving here. I was originally diagnosed with Lyme in 2001 after finding a bullseye rash in the back of my left armpit. Took Doxy for 1 month and spent next 15 years searching for answers too many crazy symptoms. In 2016, I was started on prescription on herbal antibiotics. That Lyme practitioner has since passed away. Found you in 2018 and followed your protocols until moving here. I tapered off everything except cryptolepis and more recently added Japanese knotweed because I was feeling good but getting yeasty. Where do I go from here? Do you know a really good LLMD in North Carolina? I would like to get relevant blood work, but the couple of doctors I've seen are not. So, Joyce, I'm not familiar at this point with who in North Carolina. I am going to be going to the ILADS meeting, second week in October, I believe. It's in the days before I start doing my consult visits here. I can keep my eyes out and see if I'm talking with some of my colleagues and find out who might be there, but I'm just not familiar with who is there at this point. One thing you can do is, as you're probably aware of, is International Lyme Associated Disease Society, ILADS, maintains a website where you can actually find out which members of ILADS are in North Carolina, or for that matter, anywhere in the country. Now, I got to admit, there's a lot of variations, and just because somebody is an ILADS member doesn't necessarily mean they're the greatest quality doctor, but at least get you in the ballpark of somebody that's friendly to you on this, all right? And then, if you, in terms of just something to think about, if you are not full of yeast at this point, and I'll come back to that because you said you were getting yeasty, but I think a more thorough treatment or management with herbal antibiotics is for Borrellia is to use a combination of cryptolepis, Japanese knotweed, and liposomal cinnamon, clove, and oregano. Okay. So the cryptolepis, if you're using it mainly for Borrellia or Bartonella, I like to dose it at 2.5 milliliters 3 times a day. The knotweed, I like to dose at 30 drops twice a day. And the liposomal cinnamon, clove, oregano, they come in capsules. The company called Dr. Inspired Formulations that makes them, and I like people to take 1 pill twice a day. Right? Now, that combination of herbal antibiotics does 3 things for you. Number one, it's very useful at treating both growing and persister or hibernating forms of Borrelia and even Bartonella. If you happen to have babesia going on, the cryptolepis along with clove and the cinnamon, clove, oregano is also useful at treating or managing babesia as well too. Okay, all right. Now, if you are managing babesia, then I would bump up that cryptolepis to 5 milliliters 3 times a day. All right. So in addition to treating or managing both growing and persister forms of Borrelia and Bartonella, the cinnamon, clove, oregano has one other added benefit, and that is that it's useful at removing biofilms, or slime layers that cover your germs, Borrelia and Bartonella. I mean, it's not heavy if you have a Borrelia and Bartonella, and it helps break up those biofilm slime layers and make it easier for the herbal antibiotics to get in. Okay, right now, if you are, it is possible, and many of you that have been through my webinars know this, that I preach. Search of God, but in the search of God, the one thing you want to do is always make sure that you're looking to see if you're feeling worse. You've got to ask the question, is it too many yeast in your intestines? Is the decline caused by too many yeast in your intestines, right? And many of you that are not familiar with this concept are probably thinking, well, why would yeast have anything to do with feeling worse? Well, remember earlier talking about cytokines and Herxheimer reactions, and also just about cytokines producing most of your tick-borne infection symptoms. Well, if you develop too many intestinal yeast, they also trigger excess cytokines too. So in my experience, when somebody's been doing better and then they get worse, and this can even be years after they were treated, if somebody's doing well and then they get worse, always look for intestinal yeast overgrowth. And in my experience, about 80% of the time, that's what it is. That's the decline. Okay. All right. The questions to ask yourself to help you figure out is it intestinal yeast overgrowth is if you have a lot of sugar dating, if you happen to have something that is sugary or more carbohydrate related, you feel worse for it. Right. If you get worse, pretty soon after you take it. Are you gassy or bloated? If you're female, are you having any vaginal itching or vaginal discharge? And then one other symptom that I find interesting is anything skin related to get worse when you have intestinal yeast overgrowth. Okay, and so that can be that. I mean, you might like your eczema might get worse. Your seborrhea dermatitis, which is a rash that can form like up here in these areas, here, behind your dandruff, that also can get worse. Psoriasis can get worse. Any skin conditions can get worse, and getting a lot of pimples and acne will show up if you have disease too. So if you've got a lot of those going on, then you need to think about managing intestinal yeast overgrowth. And I have a whole protocol for that. So let me just do a quick screen share here for you. All right, so I think I got an article called Is It Yeast? Okay, so this is one of the articles you may want to take a look at. It's called Is It a Lyme Relapse? Take these steps, okay? And in here, I walk through this question. Is it yeast, okay? So, and then in terms of figuring out if you have too many yeast, you can read either this article, A Silent Problem, Do You Have Yeast? It walks through the steps to help figure that out. And then if you do have it, look at my article, which is a protocol on how do you manage yeast, and that's called this Kills and Prevents Yeast, the brief guide, okay? All right, good luck to you, Joyce. Hello, Joan. Let's see. Hello, Dr. Ross. Thanks for all the wonderful work you do. Awesome. I wish you all the best in your new practice. Thank you. I'm going to sign my lease tomorrow. They got a few fill-out things they need to do on this space, but it's going to be on Lake Union, which is this lake in the center of Seattle, just north of downtown. And from my office, I'll be able to see boats and probably some of the seaplanes taking off too. So it's going to be kind of magical. I'm looking forward to that. But anyhow, yeah, we're getting there. I probably early November, I think we'll have everything ready. We'll be ready to go. But, so that's happening. And as I mentioned earlier, I've already started accepting appointments for my educational medical consult visits as well too. I'm going to show that to you here. Okay. Anyhow, thank you for mentioning that. Let's see. Binders failed in my treatment of mycotoxins. I started itraconazole and cholestyramine. I'm due to retest with real-time lab in 6 months. I take 4 grams of cholestyramine in the morning on an empty stomach. I noted that the cholestyramine has 30 milligrams of aspartame per 4 grams. I do not have access to a compounding pharmacy in Ireland. 1, is taking 4 grams of cholestyramine once a day sufficient for treatment? 2, should I be concerned about aspartame? 3, is it necessary to keep on taking the oral binders? 4, is it okay to take liposomal glutathione while treating for mycotoxins, particularly in regard to gliotoxins? And 5, is the urine test for mycotoxins more accurate than the blood test for mycotoxins, IgG and IgE, offered by mymycolab? Okay, all good questions, all right. Let me start working through these from the top down. So, cholestyramine, the dose that works is the dose that works, all right? So 4 grams once a day could be good enough for you. But usually what I like doing is to have people take that, work up to twice a day. And so 4 grams twice a day, it becomes a little bit of a timing issue, specifically because of the timing issues around it. And that is, you need to take cholestyramine on an empty stomach. And so what I advise people to do is stop taking all medicines and supplements and beginning 30 minutes before you take it. And then you can resume those items about 2 hours later. An ideal time you can eat any time, but an ideal time to eat something is about 30 minutes after you take cholestyramine. And the reason that that's an ideal time is when your liver processes mold toxins, it doesn't detox them, but it still moves them into the bile duct and into your gallbladder. And whenever you eat something, it causes the gallbladder to contract, spilling those substances out into the small intestine, to the gallbladder, right? So if you eat something 30 minutes after you've taken the cholestyramine will have worked its way into the small intestine where the gallbladder releases this stuff, right? And so it's an ideal time. All right. But I
I often will try to work people up to at least twice a day on the cholestyramine. In terms of the aspartame, you know, it would be ideal not to have it, but I got to tell you, I know a number of my colleagues have been compounded for every one of their patients. I never did that. I had people use, because it's cheaper, easier to get your hands on, and I never had problems with it. I would have people use cholestyramine with aspartame. I personally don't have problems with people doing that, okay? And then in terms of, is it necessary to keep taking the oral binders? Well, cholestyramine is an oral binder, so I'm not sure what you mean by that, unless you may mean the the herbal binders. And what I would say is probably not. That, you know, the cholestyramine is a pretty broad spectrum binder. Okay, and then let's see. Is it okay to keep taking glutathione while treating mycotoxins, particularly regarding gliotoxins? I think so. Yes. Is the urine test for mycotoxins more accurate than the blood test? Okay. Yeah. So my mycolab is doing antibody measurements to see if you have evidence of exposure to mold toxins. Okay, I wanted to say it that way, right? The problem with making antibodies is that you keep making antibodies even when the exposure is on. In general, if you have IgE antibodies, those are the antibodies that are made to allergic reaction. IgEs tend to go away pretty quickly after the exposure in your environment is gone. So if you have IgE still showing up, it probably means that you're still being exposed in your environment. Okay, it's a way of kind of checking to see if you might have mold in your environment, right? IgG antibodies, I know that some practitioners believe that, and yeah, I believe mymycolab also teaches that by 6 months after you've gotten done removing mold toxins, if they're gone, the IgG should be negative. Okay. To be honest with you, I haven't seen the science that supports that viewpoint, because IgG antibodies are the memory of the immune system, and so they may still keep on even after those mycotoxins are out of you, right? For those reasons, I prefer using the urine test. I think it's a true measurement of, are you still peeing out mold toxins, and the only way you're peeing them out is if they're still in you. Okay, so that's my rationale. I don't trust IgG presence or absence of necessarily proving that those toxins are not there. IgE is probably more of a better measurement of environmental exposure. It may not mean, though, that the toxins are in you. Okay, all right. So,
okay, bless you, Joe.
Hello, Caitlin. Let's see. Have you ever seen false positive? Results are isolated IgM positive for Borrellia, both regular and round body mixed species, Burgdorferi, Afzelli, and Berennii, negative IgG. Armin was the last. So IgM can have false positives. I just want to let you know. In fact, IgM, in terms of how Armin is doing this, the test to see if you have antibodies, they're using, my understanding is, they're using protein mixes from germs that are killed, basically. Okay, and these are protein mixes that are found on the covering of the germ. Part of the problem is IgM antibodies may get false positives because sometimes the IgMs that attach to the proteins from Lyme might actually be maybe cross-react with the proteins found on Borrellia. Okay, all right. IGenex, on the other hand, has a method which is called the Immunoblot method, where they're basically growing Lyme proteins in the lab inside bacteria, non-Lyme bacteria, but they're genetically growing these proteins. And what they've done with these proteins is they've cleaned out their amino acid sequences, parts of the protein that might attract antibodies made against virus infections. So these clean proteins that are made by IGenex do not give you the false positive testing that IGM testing through Armin. Okay, so it's possible Armin can do some false positive tests. Okay, good luck to you. Let's see, would it be possible to ask some of your viewers what forums they are now participating in since you're shut down? I feel disconnected from the community. Unfortunately, I would appreciate that there's no way for people to communicate that here because I guess what we could do, if you're willing to give out an email, I can share that email with people and they could write you. That might be a way to do it. If you want me to share your email, go ahead and let me know what that is. Now I'll look forward to it in a minute. Okay. Hello, Lisa. Let's see. Cefuroxime dosage for chronic Lyme. I usually will dose it at 500 milligrams twice a day. All right. Some of my colleagues might dose it at 1,000 milligrams twice a day, but usually I'm going to give about 500 milligrams twice a day. Okay. Audio is muffled. I'm going to ask people, are you still hearing muffled audio or did it correct itself?
All right, everyone. I just tested it. It sounds like it's working. Are people hearing me now? Are people hearing me now? Yay. Okay, good. Sorry about that, everyone. All right, we'll pick back up here. Let's see here. Yeah, I know what happened. I'm sorry, everyone. So what happened is I had my cell phone in my pocket, and somehow my computer connected to it and was using that as the microphone. When I turned it off, it disconnected everything. So I apologize for that. All right, let's go back here again. Let's see. Hi, Joyce. Oh, we already took that one. All right. Hello, Eric. See, what do you think of high-dose thiamine for POTS and autoimmune regulation? I know some people use it. I haven't tried it before, so I don't know. I'm not sure if it's a valid way of going about it or not. Okay. All right. Bear with me, everyone. I'm just clearing some of these. Hello, Yvette. Let's see. I have a question about iron levels, which are very elevated. Ferritin is very low. I'm not currently treating. What does this suggest about babesia? Very short on breath and palpitations. I'm not sure what it suggests about babesia, to be quite honest with you. Usually, ferritin is a more accurate predictor of iron stores within the body. And that's what I tend to use. I haven't seen in my practice a babesia trigger elevated iron levels. So I would need to look more at a full picture of your labs and do a lot of questioning of you to help figure that out. Okay. Sorry about that. Hello, John. Let's see. This is my third month of 50 milligrams methylene blue twice daily. I'm taking a lot of supportive supplements like oregano, cinnamon, clove oil, Trifortify, liposomal glutathione, lubrikinase, probiotics, pectazole, berber panella, and Chinese skullcap tincture. I think it is helping as I do get fluctuations in symptoms, but nothing to say I feel like I'm better. How long should I give it until I look at adding something else like antibiotics or other herbs? Thank you. So I would want to know, so methylene blue can be helpful against both Bartonella and Borrelia. Okay. So in general, whenever you're treating Bartonella, I'm going to talk about Bartonella first. Bartonella, if you're on something that is beneficial against Bartonella, usually you'll start seeing improvement in Bartonella symptoms within about 2 to 3 months. All right. So symptoms that make me think more of Bartonella are neuropsych issues. I mentioned that earlier. So neurologic things like tremors, shakiness, psychiatric like hallucinations, depersonalization, bad depression, ongoing anxiety. Air hunger makes me sometimes think of Bartonella. It can make you think of babesia too, but you can see that in Bartonella as well too. Pain on the balls of the feet make you think about Bartonella. Rashes that look like stretch marks make you think about Bartonella. And so I would want to follow what happened with your Bartonella symptoms. And by 2 to 3 months, if it is working, you should see some improvements in Bartonella symptoms. Okay. Borrelia, Lyme, is a different animal altogether. And if we look at studies about how quickly people will turn around with Borrelia, it can sometimes take 6 to 9 months or longer. Okay. And in fact, there was a study done, not with methylene blue, but it was using a combination of clarithromycin and metronidazole, which is Flagyl. And in that, it was an unpublished study. It was presented at ILADS a number of years ago. And in that study, by 3 months of using that combination treatment for Borrelia, about 30% of people started having improvements. By 6 months, 60% of people started having improvements. And by 9 months, 90% of people started having improvements. So it can take time. Okay. All right. So again, to answer your question, I don't know. It depends on which germ you're trying to treat. Okay. All right. Good luck to you, John. All right. Let's see here. All right, right, let's see. Gina says, I have positive PCR fish test and positive for tick-borne relapsing fever. Okay, but I don't see where your question is here, unfortunately. Oh, here we go. I see it further down here. When can I start antibiotic treatment for Bartonella, and what combo do you suggest? So Gina, oh, you have diverticulitis. Gina, I'm sorry. I would need to ask you a lot of questions to answer your question. So unfortunately, I'm not going to be able to do it in this format. Okay. If you want my opinion, I'd be glad to do one of my consult visits with you. But again, I'm not going to start doing those until mid-October. Let me just do a quick screen share so you can look at that if you are interested in doing that. Okay, so for those of you that might be interested in getting my advice more directly than in this forum, you can take a look at my practice website at martyrossmd.com, okay? And I am offering a couple different ways to see me, and they're described on my appointments page here. One way that you can see me is to do an educational medical consult. Those I am starting to do beginning in mid-October, okay? The other way you could see me is for me to actually be your prescribing, diagnosing, and test ordering doctor. But if you're out living outside Washington State, you will need to travel and see me for each one of those visits, okay? If you are interested in just getting an opinion, though, take a look at all the requirements here, and you can book by clicking this button here, okay? All right. Hello, Maria. Let's see. Hi, Dr. Ross. My daughter was recently tested for Lyme because she had been feeling sort of slow and tired for the last 6 months. Her test came back negative for IgMs, but positive for IgG markers. She has had no other obvious symptoms. Looking back, she had a fever for 3 days back in April and sometimes has knee and hip pain, but is a runner and rides horses. A few times over the summer, she had fever for a day and then it was gone the next. She wakes up stuffy, but that is the only other thing out of the ordinary we have noticed. Her integrative doctor did not have a definitive opinion on if we should treat with doxy. She seems mostly well. It is hard to tell if her tiredness is typical for a teenager or not. Would you recommend treating with antibiotics or monitoring? So it's a hard question. If a person has antibodies against Borrellia, it could mean that they have an active infection still, and they're still making antibodies from that. It could mean, especially if it's IgG antibodies, that the immune system took care of the problem, and because IgGs are the memory of the immune system, they're still making it. Okay, so the question is does she have active infection? And then the other question is, even if she has active infection, is her immune system dealing with it? If she basically has no symptoms, is her immune system dealing with it? Okay. So it's a hard question, and it's something for you to talk about with her physician. If she basically is healthy, then you could make an argument, don't use the antibiotics. And the reason you could make that argument is anytime you use prescription antibiotics, you run the risk of interrupting or disturbing the gut microbiome. And the gut microbiome sends a lot of important messages to the immune system. So you could alter the immune system's response and maybe trigger more active Borrelia. It's possible, okay? In my practice, if somebody has no symptoms but tests positive, I strongly advise not treating because it could be the immune system got rid of it or has it under control, even if the infection is still in there. And I don't want to disturb the balance that the immune system has. We also don't have studies that tell us of people that have controlled Borrelia, at what point how often does their immune systems lose the battle? We just don't know, okay? All right. But it's also a decision for you to consider. If there is a concern, and I would need to ask a lot more questions about your daughter's health to see if I think clinically she has
Borrelia or not. But if she has no other cause for her symptoms other than the Borrelia, you could make an argument to treat, but you have to keep in mind you run the risk of disturbing the balance the immune system has by altering the gut microbiome. Okay, so those are the kind of things that I consider with it. Okay, all right. Good luck to you, Maria. Good luck to your daughter. Let's see here. Hello, Teresa. What is the best treatment for neuroborreliosis? Is dapsone or disulfiram useful? If one is allergic to sulfa drug, should a test before taking it? Are IV antibiotics better? That's a lot of stuff to consider. That is not a quick thing to answer here. So first of all, dapsone or disulfiram has fallen out of disfavor. There are newer studies that suggest it may not be that beneficial against Borrelia. And the other problems with disulfiram is a lot of people develop chronic neurologic pain and neuropathies as a result of being on it. So most of us are not going to disulfiram. Dapsone, I tend not to be a big user of dapsone. I have used it before, but about 55% of the time, people cannot tolerate it due to side effects. Dr. Horowitz, who is a proponent of using dapsone, has a variety of different doses. There's the quadruple dapsone protocol, the initial 100 milligram a day dapsone protocol. What I want to tell you is the data that he uses that he's putting out may be skewed. Dr. Horowitz is a big cheerleader for his protocol. If we look back at his original studies on the 100 milligram dose, about 55% of people had to drop out because they couldn't take the side effects, okay? Additionally, the improvements that people had in his original study were only about 15%. That was it, even though he was claiming great benefits, okay? When you really get at the data, it's only 15%. All of his subsequent studies that he's done on increasingly higher doses of dapsone are taken from people that already tolerated the low dose, not the higher doses. So we don't know the true dropout rate at these higher doses of people, all right? Nor do we have, and the other problem I have with his studies is he is the only person doing the chart reviews. So he's putting together all of his data that says dapsone might work based on his own chart review. And he's extremely biased in terms of how he interprets things. So I have not had good success with dapsone in my practice. And it's nothing that I generally suggest people start to begin with. Okay. All right. Good luck, Teresa. Let's see. So Mira wants to know what, let me post that one here. Mira wants to know what brand of grapefruit seed extract do you recommend? Thanks. Let me do a screen share. I'll show you what it is. It is a product of allergy research. All right, and let's just go ahead and look at what my site says. So if you're ever wondering what do I recommend for a product, just type in the name. How do you like that? It's not showing up. Sorry about that. Oh, here it is. It's the paramycrocidin right here. Okay. So this is the brand of grapefruit seed extract that I recommend. It is made by Allergy Research Group. All right. Good luck to you, Mira. Hello, Carl. Hi, Marty. You're a Seattle guy at heart. Yes, I am. Actually, it's good to be back here from Austin, where I've been for the last few years. Let's see, your thoughts and preferences on whose mold protocol you prefer between Dr. Shoemaker, Dr. Campbell, and Dr. Nathan. Dr. Campbell dismisses urine testing and the use of binders as viable. I tend to fall more in the camp of a Dr. Nathan. And that tends to be the way that I work. And so that's where I would go. Dr. Shoemaker, unfortunately, bases most of his protocols based on inflammatory markers. So VIP, TGF beta 1, C3A, C4A. These are inflammatory markers that may be elevated actually because of having tick-borne infections, right? And so just having elevation of the inflammatory markers that Dr. Shoemaker follows does not prove that you actually have a problem. For that reason, I tend to like doing the urine mycotoxin testing, which tells me whether it's really in a person or not. Okay? All right. Hello, Lucy. Thank you, Dr. Marty. I've had a reboot of my immune system after COVID 2 weeks ago. No more blood pooling. I have BART and mold toxicity. What happened? I don't know. Thank you for bringing it up here, but I'm not sure. I'm not sure what happened there. Are you familiar with Dr. Jill Chris's work with nicotine and the nicotinic receptor to dissolve the pike protein or the spike protein? I'm loosely familiar. I'm not familiar enough to comment on it. Okay. I'm sorry. I'm not too much help for you right now. Hello, Chris. Let's see. Thanks for all you do, Dr. Ross. Husband had laser-focused brain surgery for tremor. Fine. Then 5 days later, started terrible shortness of breath. After all tests in a hospital say functional med doctor diagnosed long COVID. Makes sense. Reading your articles planned, do your protocol question. What causes the shortness of breath and what to do to cure this? What do you think of vagus nerve stimulation for this? See, you do not agree with ozone treatment, and this is what functional doctor wants to rely on in addition to supplements. Any new thoughts on long COVID? Husband does have history of multiple tick bites and was treated for rash 3 times, last time in 2007. Worried about the bugs that might have been awakened. IGenex negative, but we know that may not matter. Positive IgG for mycoplasma. Should we treat? Sorry for so many questions. So, Chris, this is really complicated. I would need to spend quite a bit of time talking with your husband and you about the actual symptoms he has. I tend not to think of sudden shortness of breath coming from long COVID. Usually the shortness of breath you're going to have for COVID will be more of a continuation from the initial COVID infection and not just recovering from it. So I'm not sure what's happening with your husband, and it would be hard for me to make a decision based on this kind of a format. Okay. In terms of ozone, the reason I don't subscribe to the idea that it's a germ killer. Now, and let me round out why I say that. Ozone is an oxidizing agent. And if you were to do experiments where you take a test tube full of germs, all right, and then you put ozone in it, it will kill those germs. And so because of that, many doctors think, it must kill germs living in you. All right. But the problem is if you do those same experiments and you put a small amount of blood in the test tube, then you add ozone, you get no killing of germs at all. And in fact, in my article about ozone, I do a citation of that one article. The reason you don't get much killing or no killing in a test tube if you put blood in it is your blood is full of antioxidants that neutralize the killing effect of ozone. Now, people do feel better for getting ozone treatments. And the reason they may feel better is the studies suggest that ozone results in better oxygen delivery to your cell energy factories called mitochondria. And so you can effectively power up the mitochondria by taking ozone. And so people may feel better for that reason. Okay. So those are my thoughts on that. But I'm sorry, that it would just be too complicated in this format to figure out what's happening with your husband. That's an 1.5 to 2 hour visit in my office. And sometimes even after doing that, it's not clear to me. Okay. All right. Good luck. Good luck to your husband, Chris. All right, let's see here. Hello, Carl. Thoughts on combining ketamine therapy and itraconazole for mold? Ketamine comes from a fungus, but is also anti-candida. can be used synergistically with itraconazole, evidently, calm the stress response, then kill the mold. I don't know what to think about it. I haven't seen any studies suggesting that it's going to be helpful for it. So I don't know. I don't know. My main the studies I've looked at regarding ketamine are more for the neuropsych issues and also pain management. It can be useful for people that have ongoing psychiatric issues. And by taking ketamine, it can allow for a dissociation from those psych symptoms for a while to give people relief and may even give different perspectives on it. I think it would be quite useful in that kind of a setting. Regarding whether it can be used for mold, I haven't seen the data on that. I'll have to look into that. Okay. Thanks, Carl. All right, let's see. Hello, Mira again. Let's see. Are there special treatments for vision disturbances caused by Bartonella? No. Basically, the visual disturbances created by Bartonella are improved by killing Bartonella, basically. All right. The other thing, and so in terms of what do I think the most strong treatment is for Bartonella in terms of protocols that will get at it the strongest, in my opinion, and basically from what I've seen in my practice, is using combinations of methylene blue combined with an azole like fluconazole tends to give some of the most strong benefits that I have seen. Okay. Methylene blue at about 50 milligrams twice a day and using fluconazole at 200 milligrams a day. Now, fluconazole, you may be familiar with, is useful for treating intestinal yeast. But as an azole, there's research that came out of Johns Hopkins a few years ago that showed that azoles can be useful against growing and persistent Bartonella too. And in my practice, that combination, especially before I stopped practicing 2.5 years ago, is one of the strongest treatments I had seen for Bartonella. Okay. The other thing I like to do when people have visual disturbances as part of Bartonella is I like to do to support neurologic repair. And to do that, I like working with liposomal glutathione, that Trifortify product, at 400 to 500 milligrams with a teaspoonful once a day. The other thing that can be useful for neurologic repair is to work with phospholipid fats that repair the covering of both the mitochondria and repair the covering of your nerve cells. That product that has those phospholipid fats in it is ATP 360 by Research Nutritionals. And I usually would have people take 3 pills 1 time a day of that. Okay. So in terms of Bartonella, anything you use to kill Bartonella germs should eventually result in improvement in visual disturbances. But if you're looking for what I think is a stronger way to do that, I like using that combination of a fluconazole with methylene blue. Okay. And then again, I would look at doing neurologic repair by working with the Trifortify teaspoonful 1 time a day and ATP 360, 3 pills 1 time a day as well too. Okay. All right. Good luck, Mira. Hello, Yvette. Let's see. What infections most likely cause pericardial effusion? Bartonella, Babesia, Bartonella ehrlichia. So in my practice, what I have seen is Borrellia as well as Bartonella can lead to pericardial effusions. Probably more Borrellia than Bartonella, but I have seen it occasionally with Bartonella as well too. Okay. All right. Good luck to you. So Liza says, if I see you for an educational consult, how to get local doctor to agree to prescribe your recommendations. That's the hard part. I can't guarantee you'll be able to. Keep in mind, in my educational consults, I also do recommend herbal antibiotic options as well too, which don't necessarily require the concurrence of your local physician. sometimes what I'm increasingly finding, though, is over the years, is that more and more primary care doctors are interested in helping people with chronic tick-borne infections than, say, 5 or 10 years ago. I think some of the mood out there is changing. Often with primary care doctors, they just don't know what to do with it. So what I am finding more and more is if you bring in findings from somebody that happens to know how to manage it, they're more inclined to try it. I can't guarantee they will, okay, but they're more inclined to try it, okay? All right. Good luck to you, Liza. So Carl says, Dr. Ron Ongden in Florida has a ketamine lotion or patch, neurodirect ketamine, that he applies to the back of the neck. Low dose continuous ketamine without the systemic side effects, evidently. He is trying to get approved for sale, done trials in Australia already, evidently. I'll have to look into that again. I'm not familiar with it. Okay. Hello, Barb. Let's see. Just tested positive for Borrellia, Babesia, and Bartonella through T-Lab. Curious if having the three together suggests likely tick source. I'm wondering how much you suspect transmission of any of these among people via childbirth or otherwise. Should I be testing pets, dogs, and family members regardless of symptomatology? So it's interesting. So the T-Lab is a microscope test, meaning it's a direct test, meaning he's actually seeing T-Labs. Dr. Mozignani's lab actually sees the germ. So they're in you, okay? In terms of Bartonella, there is controversy regarding Bartonella as to whether it truly is tick-borne or whether it's already in you and it gets activated. The Centers for Disease Control, as they were doing the tick-borne disease task force a number of years ago, one of their experts on Bartonella contends it's pretty ubiquitous, meaning it's in a lot of people out there in the world. The data about whether it's tick transmitted, it could be interpreted either way. I think it is, but I'm also open to the idea that it might be an infection that's in people that happens to get activated when they have other tick-borne infections. Okay, so I just want to throw that out. Okay. The fact that there would be the three of them, though, and again, Bartonella, the data as to whether it's truly tick-borne or not it's questionable. I'm not saying it's not. I'm not saying it is. All right, but the more that of these three infections you have together suggests strongly, yeah, probably tick-borne. In terms of transmissibility, we've got evidence that Borrelia is transmittable during childbirth. Okay, there is reason to wonder if it can be sexually transmitted too, but we don't have solid science saying it is. All right. Babesia, there is limited data showing it might be transmitted during childbirth, but it's probably rarer that it's transmitted that way. Bartonella, we don't have any evidence it is, but we know other germs that act like Bartonella can be transmitted during childbirth. Okay. So it's possible, I mean, that these were transmitted through the family. Possible. In terms of sexual transmission, Borrelia maybe. Babesia, I don't think so. Bartonella maybe. But we don't have solid evidence on that one either, okay? In terms of testing pets, in terms of testing family members, the main reason I would test family members is if they are symptomatic, to see if they might need to be treated. That would be the thing. In terms of testing pets, I'm not aware of any data that shows that pets transmit to humans. I'm just not aware of it. Okay. All right. Thanks, Barb. Hello, Barb. Let's see. I have a history and current testing showing gut infections, including candida. I've been sick with long COVID for 5 years. and am nutritionally compromised, I wonder how much you consider or look at microbiome to inform risk of treating with antibiotics. So with Candida, Candida is tricky in terms of how you interpret your stool testing, okay? So when you do stool testing, it represents what's in the large intestines. It doesn't tell us what's in the small intestine, all right? And some people with intestinal yeast have what's called SIFO, small intestine fungal overgrowth, which may not show up in a stool test. If you do have yeast showing up in a stool test, it doesn't necessarily mean you actually have yeast overgrowth. And the issue with yeast is all of us have some amount of Candida yeast living in our intestines. The issue is, do you have too much yeast relative to what your normal is? And just having yeast show up in a stool test doesn't prove it's too much. Therefore, I like looking at symptom profile. I like looking, and many of you may be aware at the beginning of a treatment, I like doing a yeast questionnaire. And if you answer yes to a number of those questions strongly enough and you score over 140 on my yeast screening questionnaire, then what I have found in my practice is there's a high probability that managing and treating yeast will make a difference. I'll show you that yeast questionnaire here in a minute. The other thing you can look at is just breakout yeast symptoms. Do you have sugar cravings? Do you have intestinal gasiness, bloating? Do you get worse when you have sugar? Do you feel worse when you have sugar? Do you have vaginal itching, vaginal discharge? Do you have rashes that I mentioned earlier? And so I'm looking more at the symptom profile to suggest Candida or not, okay? Then regarding your microbiome, whenever we use whenever we use herbal or prescription antibiotics, there is a risk of harm to the good bacteria that make up your gut, okay? There's probably a greater risk of harm from using prescription antibiotics than herbal antibiotics, but there still is a limited risk that you might find even with herbal antibiotics as well too, okay? Now, in my practice, what I saw using a lot of herbal antibiotics and using prescription antibiotics, I tended to see more frequency of intestinal yeast overgrowth, much more frequency than I did if I used herbal antibiotics. But I have seen times, even on herbal antibiotics, that we get intestinal yeast overgrowth, suggesting that even herbal antibiotics can disturb the intestinal microbiome, okay? So if you are going to do things that might injure the intestinal microbiome, you want to do things while you're taking them, either herbal or prescription antibiotics, that support the healthy intestinal microbiome. All right. And those things are, number one, make sure that you have a diet or you're taking supplements that are rich in polyphenols and in prebiotic fibers. Okay. So polyphenols are found in colorful fruits and vegetables. If you happen to have a lot of colorful fruits and vegetables and even coffee, polyphenols support good intestinal microbiome. If, on the other hand, you can't get it in your diet, then I suggest people take a pill called Polyphenol Booster. It's made by a Pendulum, and it can support a healthy intestinal microbiome. The other thing I strongly suggest when you're on herbal or prescription antibiotics is to be on, make sure you're getting enough prebiotic fibers. Prebiotics are basically starches that we physically do not digest, but our bacteria do. And our bacteria use those as a food source, okay? Now, you can get prebiotic fibers from your diet. If you happen to have a diet that's rich in beans, legumes, whole grains, fruits and vegetables, then you're probably getting enough prebiotic fibers. If you are not a person that has that type of diet, then I suggest strongly that people take prebiotics. And the product I like for a prebiotic is a product called MegaPre by Microbiome Labs. And I have people take 2 pills 1 time a day. All right. So if you happen to have a diet that's rich in fruits, vegetables, beans and legumes, whole grains, you're getting enough polyphenols probably. You're probably getting enough starches. If not, you need to supplement both of those. All right. Secondly, or thirdly, while you're on herbal or prescription antibiotics, I suggest strongly that people take probiotics. Now, it's true the antibiotics may be knocking them down, but it's also true that you can still support healthy microbiome by being on those probiotics. All right. Now, if you happen to have no GI symptoms, I suggest using a spore-forming probiotic, like a Corebiotic, by research nutritionals. That can be very helpful. The spore-forming probiotics do a good job getting through the stomach acid and helping promote good bacteria in the intestines. On the other hand, if you happen to have a lot of GI symptoms like cramping, gassiness, bloating, I find it more useful to use a probiotic that has multiple strains, including Akkermansia and various other strains of bacteria that promote butyrate production. Butyrate is an organic acid that is useful at supporting the intestinal cells and limiting the potential of having leaky gut. The product I like for that is a product made by Pendulum called Metabolic Daily, and I have people take 2 pills 1 time a day. Okay, so in terms of how you support your gut, polyphenols, probiotics, and prebiotics. Okay, that's the way you do it. Let me show you an article where you can read more about this. So take a look in my guides here in the, where are we here? Gut. Oh, here, stomach and intestine section here. And take a look at this article called Your Guide to a Healthy Intestinal Microbiome, even on antibiotics, where I walk you through the various things that you can do for that, okay? And then in terms of the products I recommend, take a look at, let's go here. Let me see. In the yeast section, I'll probably have them. So in terms of that mega prebiotic I mentioned, here it is. And then in terms of the Metabolic Daily probiotic, here it is. And then in terms of the polyphenol booster, it's this product right here. Okay. All right. All right. Listen, I'm actually renting a room to do the webinar tonight. And so I have to be out of here in about 5 minutes. So I'm going to wind up ending the webinar tonight so I can get out of here in time. I apologize for the sound difficulties. I understand what happened now. My computer somehow connected with my cell phone. I wasn't expecting that. And that kind of messed things up. I hope you all were still able to get something beneficial out of the webinar tonight. And then, yeah. Anyhow, that's what I got. Look tomorrow morning somewhere between 9:30 and 10 Seattle time, and we'll have a summary of what we discussed tonight in the webinar along with the recording. I hope the sound turns out better in the recording. All right. And then take a look tomorrow morning. I'll also provide you the link that you can sign up for next week. We are going to be doing, I think, 3 or 4 of these in a row now. Yeah, anyhow, feel free to sign up for next week as well, too. All right. Good night, everyone.